Hi, I'm Dr. Larry Malerba. Welcome back to the All Things Homeopathy Materia Medica series. Today I'll be talking about Belladonna, a commonly indicated and frequently used homeopathic remedy. Belladonna is a highly poisonous perennial plant from the Solanaceae family, which is the family of nightshades. The Latin name is Atropa belladonna. It's also known as the deadly nightshade. Homeopathic belladonna is prepared from the whole plant in the stage when it is just beginning to flower. As with bryonia in our previous discussion, belladonna is primarily indicated for acute ailments, especially fevers, but it can be also used to treat chronic conditions too. With that said, let's jump right in.
Okay, so Dr. Hahnemann famously used belladonna to prevent and treat illness during outbreaks of scarlet fever. Belladonna is a near perfect fit for the high fever, bright red rash, sore throat, and strawberry tongue that characterize most cases of scarlet fever. By the way, you can learn more about this history by watching ATH episode number 21, Homeopathy and Epidemic Disease. Now, Hahnemann classified belladonna as a remedy of the acute miasm. This is the miasm of infectious and or epidemic diseases. Along with scarlet fever, this category includes illnesses like measles, yellow fever, cholera, and whooping cough. Indian homeopath Dr. Rajan Sankaran has expanded the idea of the acute miasm to include remedies that exhibit hydrophobic traits. He places belladonna in the acute or hydrophobic miasm, which can also be referred to as the rabies miasm. The hydrophobia of rabies is associated with symptoms like extreme agitation, aggression, and a fear of water and shining objects. The symptomatology of both acute and hydrophobic miasms is characterized by an oftentimes sudden, intense, and immediate threat to the safety and life of the patient. This threat can be either physical and or psychological, and remedies belonging to these categories include aconite, belladonna, stramonium, and veratrum album, among others. Now let's break belladonna down into its most characteristic features. We have suddenness of onset, intensity or explosiveness of symptoms, congestion and inflammation, heat or fever, redness of the parts involved, and pulsating sensations and throbbing pains. A good way to think of the belladonna state is that it involves a sudden rush of blood to a part of the body. The particular part then becomes red, hot, inflamed, and feverish, and it pulsates with pain. We could say that this congestion of blood is an underlying theme that characterizes much of belladonna's pathology. Belladonna symptoms are intense, acute, violent, and explosive. They come on very suddenly and tend to settle down just as quickly. The involved parts are congested with blood and, as a result, become very red and hot, oftentimes bright red. The belladonna state is often associated with high fever. Now imagine for a moment the child with a belladonna ear infection. Fever rises suddenly and dramatically. Blood rushes to the ear, which then becomes bright red. The eardrum is red and bulges out, and it pulsates violently and painfully. It goes boom, boom, boom. Now imagine a similar scenario in a chronic case of migraine headaches. With each migraine, blood rushes suddenly to the head. The face becomes bright red and hot, and the head pounds and pulsates painfully. This rush of blood can occur to different body parts under different circumstances. Blood may suddenly rush to an injured body part, which then becomes very red. Blood may rush to the uterus during the menses. The blood pressure can spike in a person with hypertension, along with a hot, flushed feeling in the body. And blood may rush to an inflamed tonsil that becomes swollen and painful. In all such cases, the phenomenon is basically the same. The belladonna state involves a sudden, dramatic, congestive, or inflammatory event that results in heat, redness, and throbbing. This is not a remedy for subtle or mild symptomatology. All right, now let's talk about some additional belladonna clues, beginning with some of the generals. Generally speaking, belladonna is warm-blooded, and there can be flushes of heat. However, many belladonna types are prone to having a red, hot, flushed face accompanied by cold hands and feet. This makes sense when we understand that the blood often rushes to the head and away from the extremities. This can happen, for example, during fevers, hot flashes, migraines, or spikes in blood pressure. The old books refer to belladonna types as being plethoric, meaning that they are full of blood and prone to inflammations. They have a red, robust appearance and a tendency to flush easily, with heat and redness of the face. My own observations have led me to think that constitutional belladonna types are big, strong, and powerful. And although usually quite friendly, they have a strong presence, and they tend to come on strong. But more about this later when we get to the mentals. Now, another important general is the fact that belladonna symptoms tend to have a distinct right-sidedness. There can be right-sided headaches, right-sided ovarian pains or ovarian cysts, and even right-sided facial convulsions. The main standout belladonna food preference is a desire for lemons or lemonade. This preference for sour is not always present, but when it is, it's a good confirmatory clue for belladonna. Another clue is thirstlessness or an aversion to liquids, especially during acute febrile conditions. One more general worth noting is that there's a lot of overlap between belladonna and calc carb. The two remedies have a very strong relationship, and so it can sometimes be difficult to tell the two apart. Now let's take a look at some of the belladonna modalities. There are two main modalities that stand out above all others. The first is an aggravation of symptoms at 3 p.m. I always think of belladonna when a fever begins or peaks around this time. This time modality can also apply to other symptoms, especially chills or headaches. The other prominent modality is an aggravation from jarring. To jar something means to suddenly or forcefully shake it or move it. The person with the pounding belladonna headache wants to lie quietly in the dark, and accidentally bumping into the edge of the bed can be jarring and will trigger a wave of pain. Additional modalities related to jarring are an aggravation from motion, aggravation from stepping, aggravation from coughing, and an aggravation from touch. The belladonna headache is worse from light, worse from noise, better from lying in the dark, and better from firm pressure. In terms of environmental factors, belladonna symptoms can be aggravated by changes of temperature. This includes worse from becoming chilled and worse from being overheated. We may also see an aggravation from the heat of the sun and aggravation from a draft of air. Belladonna is the strongest remedy listed under both head pain from getting the head wet and headache from cutting the hair. An additional modality includes worse from swallowing. This applies especially to throat pain. And lastly, there can be an aggravation from seeing running water or looking at shining objects. These two modalities are related to the Belladonna mental state, which is up next in our discussion. Okay, now the Belladonna mental state can be just as sudden, explosive, and violent as its physical symptoms, and we're most likely to see this kind of behavior during the altered state of a feverish delirium. It can also be associated with psychiatric illness, especially during acute flare-ups of mania or psychosis. The Belladonna state of fear and aggression can be likened to the behavior of a rabid animal. This rabid mindset or hydrophobic state is characterized by paranoid terror and explosive rage. The person may be gripped by a furious or ferocious rage. It's the kind of rage that is fueled by surges of adrenaline. Hence, rage may be accompanied by surges of superhuman strength. It can be extremely difficult to handle persons who are in this kind of delirious or psychotic state. A person in this state can be highly reactive and may suddenly lash out in anger. In this altered state of violent, feverish, or psychotic delirium, the person will act wildly and do wild things. He may tear things to pieces. He may try to set something on fire. He may strike others, pull their hair, or spit at them. He may even growl or bark, just like an angry, rabid dog. However, the one most commonly seen behavior in this altered Belladonna mental state is biting. There's a strong tendency to bite, and they'll try to bite just about anything, including themselves. Belladonna is the only remedy listed under mania, madness, spits and bites those around him. Belladonna and stramonium are the two most prominently listed remedies under biting in delirium. Belladonna also lists prominently under rage with biting, biting people, biting oneself, biting in children, biting objects, biting his own hands, and biting everything. I'll never forget the time back in medical school when I was accompanying a psychiatrist on rounds in the psychiatric ward of a hospital. I was shocked to see this very large woman with a bright red face who was restrained in her bed. She was essentially tied down in order to prevent her from biting. Her frenzied state of mind caused her to bite at anyone or anything she could get her hands on. Looking back, I feel sad that we have such a closed-minded medical system that arrogantly refuses to consider a therapy like homeopathy, a therapy that no doubt could have released that poor woman from her misery and suffering. Now, the flip side of Belladonna's rage is fear. In fact, fear and rage can alternate with each other. And the rubrics that most accurately represent Belladonna's fears are the escape rubrics. The essence of Belladonna's fear is a feeling that one must escape from a sudden threat to his or her life. In his delusional or delirious state of mind, he is beside himself with terror and believes that he is in danger. He must hide or escape from whatever it is that he thinks is pursuing him. These threats can present themselves as delusions, visions, fears, or even dreams. When in this altered state, he may have hallucinations about these things that pose a threat to him. He may have visions of enemies, snakes, fire, hideous faces, or monsters. Many of Belladonna's fears and delusions are listed prominently in the repertory. They include the following: a desire to escape in delirium, delusions of animals, delusions of insects, delusions of devils, delusions of dogs, delusion that he sees faces, fear of animals, and fear of dogs. These visions may become worse when he tries to close his eyes. One additional prominent Belladonna fear is a fear of water. And this brings us back to the idea of the hydrophobic miasm. Hydrophobia is a fear of water, and it's a very common symptom in cases of rabies. The hydrophobic state is characterized by rage and aggression, hallucinations, a feeling of being under threat, fear of water, a sense of suffocation, an aggravation from seeing running water, and an aggravation from seeing shining objects. Additional hydrophobic features include grinding of the teeth, staring, an aversion to liquids, and a desire for light. While these hydrophobic symptoms can occasionally be traced to an actual case of rabies or the rabies vaccine, the vast majority of cases that display such traits will have no connection whatsoever to rabies in either the personal or family history. So this hydrophobic miasm idea is really just a convenient and effective way of thinking about these types and patterns of symptoms. Now, it's also important to understand that most belladonna cases are not going to exhibit such extreme psychological symptoms. Most of the time, we prescribe this remedy based upon physical symptoms alone. We give it most often when we see sudden onset, high fever, intense redness, and pulsating pains. Interestingly, my personal experience of the belladonna constitutional type is that they are big, strong, powerful people with strong personalities. They often have a lot of calc-carb traits, but they're also vigorous and intense. They're friendly, lively, extroverted, and full of energy. They're exuberant, loquacious, and cheerful. While they may not present with complaints involving fear or anger, when asked about temperament, they may say something like, "Well, I'm not really an angry person, but boy, when I do get angry, watch out." All right, now let's talk about some more of belladonna's physical symptoms. Okay, so in most cases, we're going to prescribe this remedy in acute situations. Symptoms develop suddenly in violent paroxysms and then settle down just as suddenly. Symptoms we expect to see include great redness and pulsating pains or sensations. Belladonna's pains can also be sharp or shooting. There may be high fever with a bright red hot face, dilated pupils, throbbing carotid arteries, and cold hands and feet. There may be thirstlessness with a dry mouth or a desire for lemonade. Recall that blood rushes to the affected part, which then becomes bright red and inflamed and pulsates with pain. The skin of the affected area is hot, dry, and can turn a shiny scarlet red. The belladonna fever often begins or peaks at around 3 p.m. When the condition is severe enough or the fever is high enough, we may see delirium with fear, rage, or hallucinations. Belladonna is listed in the repertory under intense fever with delirium, furious delirium with burning fever, confusion of mind during fever, mania during fever, rage during fever, and screaming during fever. Now, just like Nux vomica for hangovers, belladonna has an exaggerated reputation for being the main remedy for fevers. This just simply isn't so. There are many remedies that can fit fevers. I don't recommend reflexively giving belladonna at the first sign of a fever without first thinking about the situation. It's always important to observe and evaluate before choosing a suitable remedy. Now, it makes sense that belladonna would be a fitting remedy for circulatory problems or imbalances. We've already seen how it involves the congestion of blood to a part, resulting in great redness. Pains are throbbing or pulsating, and there may be a full bounding pulse. Belladonna can be a remedy for hypertension, especially when the blood pressure tends to shoot up suddenly. Just as blood rushes to the affected part, it also runs away from other parts, especially the hands and feet, which tend to become cold. Belladonna is also a remedy for vascular migraines. The typical migraine is right-sided and extends from the occiput or back of the head to the right frontal region above the right eye. Of course, the onset is sudden and the pain is severe and throbbing. It can be worse at 3 p.m. and is usually worse from being jarred and worse from light. The headache is better from cold applications and better from wrapping up the head. The pupils may be dilated and there can be a corresponding sensitivity to light. Now, sticking with head symptoms, belladonna can be an effective remedy for treating cases of vertigo. The vertigo is usually worse from turning the head, worse from turning in bed, and worse from bending forward. A belladonna ear infection, not surprisingly, is right-sided, throbs violently, and the pulsating may be synchronous with the beating of the heart. Of course, the ear is also bright red, either internally and or externally. And lastly, a belladonna sore throat is similarly right-sided, red and swollen, and aggravated from swallowing. Now, belladonna can also be indicated for a variety of female health problems. The menses can be painful and very heavy, and the blood is typically bright red with large, dark clots. The blood can be hot, and I've had patients tell me that it comes in gushes with each beat of the heart. In cases of mastitis, there's a fever, and the breast is bright red, hot, and aggravated by jarring. Now, as we've already seen, belladonna is a remedy that profoundly affects the brain and nervous system. It can be a remedy for meningitis, encephalitis, hydrocephalus, and seizure disorders. There can be twitching and jerking and spasms of muscles associated with all kinds of conditions. There may be increased sensitivity of the senses, and sometimes we see neuralgic pains. There can be kicking and jerking during sleep. One particular belladonna symptom that points to the likelihood of a brain problem is boring of the head into a pillow. Finally, we must always consider belladonna when a seizure is brought on by a high fever. All right, now let's finish up with remedy relationships. All right, so there's a very strong relationship between calc carb and belladonna. They're considered complements, and calc carb acutes will often respond favorably to belladonna. Remedies worth comparing to belladonna include aconite, which is also indicated for sudden acute conditions, especially fevers, with great symptomatic intensity. Apis, likewise, is right-sided and known for its heat, redness, amelioration from cold applications, and lack of thirst. Stramonium is another hydrophobic remedy that can also be explosive, rageful, terror-stricken, convulsive, and delirious. Hyoscyamus and Listen, aka hydrophobinum, are also hydrophobic remedies that have many traits in common with both stramonium and belladonna. Glanoinum, which is made from nitroglycerin, is another explosive remedy that fits hypertension and congestive headaches with violent pulsating. Sanguinaria has very similar right-sided migraines that begin in the occiput and extend to the right frontal region. It also fits flushes of heat and hypertension. And lastly, amyl nitrite produces hypertension and facial flushing with violent pulsations throughout the body. Okay, that's my take on belladonna. I hope you found it helpful. Thanks for watching. Please don't forget to subscribe. I always appreciate your questions and comments, and be sure to check out the large variety of educational videos at the All Things Homeopathy channel. May the vital force be with you.